Hi there. Welcome to ComplyPlus Presents. We're here for another episode today. I'm joined, as usual, by Dr. Richard Dune over in the Philippines. How are you, Richard?
Pretty good. Very hot here. Probably nothing new there, but it's been pretty good. Had a bit busy, but that's what we kind of expect. It's not a proper vacation. There's a lot of work to be done as well.
Excellent, excellent. So, yeah, I'm here as usual in our studio in Coventry. And today we want to talk about a subject that affects every professional in the industry, and that is continuing professional development, or CPD, if we're using the buzzword. The reason we wanted to discuss this today was we've had a lot of requests from clients recently about what CPD they need, what CPD is valid. How do you know if something that you're doing actually contributes towards your CPD or your continuing professional development? And as many of you will know in the industry, some of you have to do things like revalidation, and CPD is a crucial part of that revalidation process. So we felt it was a good time to touch on this subject, discuss some of the myths, discuss some of the things that you can start thinking about or you can start looking for in the marketplace. There's a lot of CPD available, some of it free as well. And also maybe touch on some of the things we can potentially help you with as well towards the end. So, yeah, Richard, maybe if we get started straight away, we always like to start with definitions. So, what is CPD in layman's terms?
It's really crucial. When we talk about CPD, that's continuing professional development. It's an ongoing process where we maintain, develop, and enhance skills and knowledge that health and social care workers need to deliver safe, effective, and up-to-date care. So there are key elements there that obviously we'll go into more detail. But it's really crucial to understand that it's not just a one-off course or a single certificate. It's continuous lifelong learning. And when you go back, even when you talk to people in general, they know that they have to do some CPD. But sometimes actually people don't approach it strategically. Then they end up just rushing last minute to do whatever course they say. So it's really important that people think about it as something that is almost part of their professional DNA rather than panicking last minute to try to get certificate in any course that you do. And when you think about health and social care in general as well, there's always an element of structured learning. For example, if you're working in a hospital, they may introduce new equipment where you have to learn, about how to use that equipment. We'll talk about different types of learning, but it can be informal, it can be formal. One key element is reflective practice. You mentioned revalidation there in passing, but that's a crucial part for nurses when they apply to stay on the register. So it's really important because the sector is constantly evolving, the new ways of working, new treatments, new technologies, new regulations, changes in the law, and risks are dynamic. They're changing constantly, and it exposes a lot of gaps that sometimes lead to serious harm or even regulatory breaches. So there's so much to think about from a legal, from a regulatory perspective, from a professional perspectives, but it's all about the outcomes that we expect for people. Even if we ourselves, as health and social care workers, end up in a hospital or a care home, what sort of care do we expect? We want it to be evidence based. We want it to be up to date.
Excellent. And like I said, there is a bit of a misconception. There are a few myths around CPD. It isn't really just a case of putting loads of paperwork together, gathering lots of certificates.
Definitely, definitely. When you think about it, it has to have relevance to your work environment. Take example of adult social care workers. Some of them are working in a care home, for example. They're not registered with a professional body like nurses or doctors. Or maybe they're working in domiciliary care, or maybe they're mental health support workers. So there has to be relevance to the work that you're doing. Of course, you can learn about anything, but unless you can apply it to the work that you're doing, then it has no relevance really. And even from a regulatory perspective, it doesn't really serve you at all. But also, most importantly, for the people that you are supporting, if there's no relevance to the work that you're doing, then there's no point doing it.
Hmm. No, I think that's very true. So let's talk about the things that people probably really care about. What do they actually have to do? What's compulsory? What's required? We live in an age now where people will unfortunately do the bare minimum. So I think it's good for people to know actually what they need to do from a sort of regulatory perspective. So in terms of what's actually required, what do the different regulatory bodies mandate when it comes to CPD?
It's really crucial to think above the regulatory bodies. So I imagine you're talking about the Nursing and Midwifery Council, General Dental Council, and the like. But actually, above that, you have laws of the land, which is the legislation, right? For example, the Health and Safety at Work Act is for so many requirements on individuals and organizations. Then you have the regulatory bodies like the Care Quality Commission, who also require organizations to work in a certain way and they have expectations on how CPD should be done. Then also we go to the professional bodies. So before we talk about the individual professional regulators, let's look at a wider landscape, right? Say, look, CPD is a legal and regulatory necessity. So the laws, actually, there's an expectation if you think about duty of care, for example, if you think about duty of conduct, if you think about the Equality Act, the specific requirements that actually which places specific expectations on the sector. So Health and Social Care Act 2008, Regulated Activities 2014, regulations. There is Regulation 18 from the Care Quality Commission, which looks at staffing. It requires health and social care providers in England, for example, to ensure that staff are competent, they're skilled, and have the necessary qualifications to carry out their respective roles. Then you have the specific CPC standards themselves, where providers are required to demonstrate that staff are supported to maintain and develop their skills through ongoing training, supervision, refresher training, things like that. Then various care standards across the UK countries, the working time regulations and laws, these are across Europe, NHS contractual requirements, and any organization that is working with local authorities or other statutory bodies, there are specific requirements. This matters because if you are a professional, um, healthcare professional, social care professional, you don't just do the bare minimum. Of course, your professional regulator may set standards, but actually, there's a legal requirement there for you as a registered professional to continue lifelong learning and evidence your CPD because actually it could be a breach of your professional standards. But when you think about the directed frameworks. So if we look at specifically Nursing and Midwifery Council, they require nurses to do 35 hours of CPD every 3 years as part of the revalidation. 20 hours must be participatory. So, which means that it's group learning and it could be workshops, webinars, face to face training, things like that. It has to link to the scope of practice and recorded with evidence. So, this is actually a professional requirement. If you fail to do that, NMC won't re register you. And many people have fallen foul. They've got everything. They may even have done all the CPD, but they can't evidence it. And that's a problem. Then, if you look at other bodies like the Health and Care Professions Council, HCPC, there's no fixed number of hours, but there's focus on relevance and quality. So you actually almost self-regulate in that sense for paramedics, for social workers, for radiographers, physiotherapists, and many others like that. So you must maintain a verifiable record of ongoing learning and also subject to random audit. So there's always it's not like policing in a way, but regulators actually need to ensure that you are audit ready. So if they say you maintain your own CPD log, they expect you to do it. You could be picked randomly for that audit. Then when you go to the General Medical Council, they do an annual appraisal for all doctors. And part of that, actually, with the supervisor, is to do a CPD review. There's a good medical practice standards that doctors have to follow. And there's an expectation also that if you're a specialist doctor, you have to think about the patient safety needs within that specialty, whether you're working in A&E, we are working in theaters, you're a GP or prison doctor, there's an expectation that you're going to align with what is required in that area. Then General Dental Council, they have structured CPD cycles with specific core topics, depending on what you're doing. So things like disinfection and decontamination, radiography, medical emergencies, and certificates must include detailed learning outcomes. You know this because we worked at the General Dental Council a few years ago to structure these CPD certificates so that they meet their regulatory requirements. So if you are practicing, you are learning as well. Every time you practice, you learn from that. But as long as you can evidence it, and also you get it countersigned by a supervisor or a senior colleague, that kind of makes sense. We'll discuss that in more detail later on. So Whether it's a service regulator like the CPC or professional regulator like General Medical Council or NMC, the themes are the same. Every professional must keep learning. It's got to be relevant as well. It's got to be continuous, and you have to be ready all the time. You have to have your evidence ready. So I know it's a bit of a long explanation there, but it's really crucial that it's not a one size fits all. We have to know what counts and what doesn't count.
Mm. And I think also, like you've been saying there, that things change a lot in this sector. No, particularly over the last few years with some unprecedented events like COVID, and other things going on. So, yeah, continuous learning is important. And I think the takeaway there is to say if you're practicing, you should be learning. But more importantly, you also need to prove that you've done it, because without evidence, it's as good as not doing it, basically.
Definitely. There's a saying actually in health and social care. If it's not evidenced, if it's not documented, then it wasn't done. As simple as that. Even it doesn't even hold in court. You go to a tribunal or you go
Yeah.
to any sort of investigation. If it's not evidenced, then it wasn't done.
Yeah. No, it makes a lot of sense. So if we start looking into sort of the nitty-gritty side, what actually counts as valid CPD? And maybe also let's touch on some of the things that don't. Because there's all sorts of balmy theories when you go on social media or you see what people are putting on some of these forums, even in some of our own Facebook groups, what people think actually classes as CPD. It's quite interesting, the theories people have.
Definitely. So when you talk about CPD in health and social care, it takes different forms. I did mention earlier that it can be formal, it can be informal, and but actually it doesn't mean that you're not learning if it's not formal. You're still learning. That's why reflection is important. The key is that it contributes to your professional knowledge, your skills, and competences. So I'll talk a little bit about formal learning. There's so many ways of formal CPD. You can go to the traditional training courses where it's in person. It could be online because we do webinars now online. So it's designed to teach specific skills or knowledge that is specific, maybe about a new regulation and how it applies to your work. You can go to a workshop, which is interactive. It's hands-on session focused on developing practical abilities. I mean, we do this when we do train the trainer in resuscitation skills or epilepsy, emergencies in epilepsy. You can do seminars, which are very common now. They started during COVID, online seminars that are structured presentations and discussions on a specific topic. Conferences have always been popular because these are large scale events with several keynote speakers, breakout sessions, networking opportunities. But again, some conferences don't offer certificates, so you have to always think about the evidencing things. Then there's a lot of online training. Ideally, it has to be accredited. And e-learning modules that must have clear objectives, clear learning outcomes, and have certificates that can be validated, which is why the accreditation is important. Then informal training, we're looking at experiential types, practice-based learning, which is very common when you think about health and social care. It's always been about apprenticeship. You learn from senior people, so on the job training. So you're gaining new skills through direct work experience. Then there's mentoring and coaching, which is getting more popularity now, learning from more experienced colleagues. There's peer review or case discussions, which are also common. So it's about critical thinking, evaluating with colleagues. Then attending events for networking, so they're informal, but alongside formal programs as well. Then the non-formal tends to be self-directed, independent learning, which again is getting more and more popular. So the key thing there is about reflective learning. Uh, reading industry publications, reviewing case studies, thinking critically about your own practice, then being able to evidence what you've learned and how it's going to change your thinking, how it's going to change your actions, and how it's going to impact patient outcomes as well. Then self-directed learning, you could research a topic or complete voluntary modules. When I worked in the emergency department, I hadn't worked in A&D for many years, and I kept a notebook on me so that every time I came up with something that I'd forgotten, maybe, or I was completely new to me, I would document it, then I'll work with somebody to do it, then I'll go and read it after to ensure that if I ever encounter that situation again, I should be able to do it with confidence. Um, Engaging with professional networks as well, you did mention about online forums. They can be quite useful. but they can also be completely pointless and sometimes lead you in the opposite direction because it depends who is leading these forums. Is there somebody actually um, almost invigilating how things are being done in a way, validating, because some of them are spewing out wrong information where people can actually go there trying to learn, trying to understand what's going on. But then if people give them wrong information, then it's not necessarily their fault. But again, selecting that forum, when you select a forum, you need to think about its usefulness as well. There are many discussion boards, special interest groups, but some of them are so, they have so many vested interests. You need to be careful how you select them. And we have gone into this space because we realize actually even on LinkedIn, on Facebook, on Twitter, TikTok, there's so much wrong information. So we've gone into these spaces deliberately at our own cost actually to invest so that we run some of these sessions as well through podcasts like this, through webinars as well. So I'll give some examples now just to summarize some examples of valid CPD activities. So you could read relevant journals, magazines, or online research papers, but again, evidencing and reflective practice. Undertake accredited training programs, online courses, participate in peer review, mentoring, and shadowing schemes. Many workplaces are doing that now. You could understand, you could attend also relevant professional events and engage with the content meaningfully as well. You could contribute to curriculum design and development so that you actually learn how to do that, but it's part of your research and understanding as well. Uh, some people get asked to write book chapters or articles or blogs or research papers. You could shadow someone as well in a different area or undertake a secondment, move from the area where you're working and go and work in a different area so that you learn how things are done in that area. You could lead or contribute to significant project work. So validity, it must count, it has to be relevant. So to your role and scope of practice, it must have clear learning outcomes. So our learning outcomes are the things that you'll be able to do immediately after undertaking that CPD activity itself. It has to be recorded in a CPD log. So however you keep your CPD log, you must record it, the date, the times, the outcomes, the person delivering, the organization delivering, and if you get a certificate, you log it as well. Then evidenced with certificate, attendance record, or project summary, or reflective notes. What doesn't count is just watching a random YouTube video with no link actually to your role or reflection, or some passive attendance without applying the learning. And a lot of people are being caught out actually by regulators and even by employers where they've got the certificates, but they can't actually do what it says in the certificate. So completely pointless, and it could be fraudulent as well, like that. Some people just purchase a certificate from non-reputable provider purely to meet a quota. We have had people, organizations come to us actually saying, can people just go and do a test and get a certificate? Of course, we're not going to let that happen. Right? And activities where there's no evidence of impact on your practice. So if you can't clearly describe what you learned, if you can't explain how it applies to your work, and if you can't provide the evidence, then it's pointless. And regulators actually can see from a mile when you try to do that. It's important that you also engage with the organization. A lot of organizations lately now are very good at identifying learning needs for their staff. They're very good at planning activities to meet those needs. And also, it's up to you now to act. So you take part in that learning activity, you record it for yourself, organizations record for themselves because they need the evidence, and you need to be able to reflect and apply that learning as well as evaluating the impact on your practice. So you follow this sort of model consistently, CPD becomes easier to do, becomes purposeful, becomes relevant and easy to evidence. And obviously tracking is important. Tracking and evidencing is very sure.
Yeah, thank you for that, Richard. So we're basically saying if there's no reflection or proper evidence, it's really not going to cut it, and you're probably wasting your time.
Definitely, because we're in an era where there's a lot of litigation now. If you look at the NHS, actually, just the National Health Service, how much money they are wasting in paying for poor practice, for people that have been harmed or neglected. And a lot of it goes back to the basics to say, look, are we taking our responsibilities seriously? And CPD is really crucial because sometimes people genuinely believe they're doing the right thing, but it could be out of date, right?
Mm. Excellent, excellent. So you mentioned in the last segment about the importance of tracking. I just thought I'd go into that because it is again another area where there's a bit of uncertainty. We're trying to move away from having cupboards and files of loads of certificates and evidence and this, that, and the other. So what's the practical side of how can professionals sort of efficiently track their CPD, because it is an ongoing thing, because these events can happen all throughout the year or the 3 year cycle, whatever it is. What sort of advice would you have for professionals trying to track their CPD in today's world?
It's a really big problem because I've seen people whereby they're desperately trying to go through their revalidation with their nurses, or they're desperately trying to go through their supervision with their doctors, and they're calling any organization that would give them some sort of training, especially so that they can go through that. And even organizations that are going through an audit, or they have to prove to commissioners that they actually have done what they say they've done, they're desperate now to get that documentation. So CPD has to be consistent. So a tracker needs to be used regularly and updated, not just before deadlines, because you do that, actually, you're going to miss a lot of things, and it's going to be very stressful and costly as well. It has to be comprehensive, so it has to capture every relevant activity that somebody has sort of undertaken. And it's got to be audit ready, which means that produce the evidence in the format that regulators expect or want. So I'll talk through a few things there, just to add a little bit more information, how to maintain a CPD log, whether it's paper or digital based. So you got to choose a format that you're going to actually use, because some people pay for some of these platforms that say, oh, log your CPD. And then it's terrible, actually. It's difficult to track what you're doing. It's difficult to download anything.
Yeah.
So it's better actually to have a very simple system that you actually stick to, rather than a complex one which you abandon, or is not going to serve the purpose. So the key element, and I've done that myself as well, so look, immediately after an activity, whether I've gone to conference or I've done a course, just write it down straight away. Put the certificate in a folder, if it's a paper folder or a digital folder, then write a reflection on that particular activity. It only just takes 5 to 10 minutes. Because even waiting even by 1 day or 2 weeks or whatever, you end up actually forgetting what you've done. You forget the details, and you end up not doing it at all, or just ticking boxes. So each entry, when you do it, whether it's paper based or it's digital, write the activity name, whether it was a course, it was a workshop, it was a discussion project, it was a mentoring session, what date, so where did it take place, and when. So you might need to also even put a postcode, the building, the postcode, everything matters there. Then relevance, why does it matter to your role, and why does it matter to your career development? Then you have to have a reflective activity here. What have you learned? How does it apply to your work? Any changes that you're going to make to your practice or the service users? Then evidence, if you have a certificate or signed attendance sheet, meeting notes, project outcomes, then the promptness is really important. Could you hand this log to your regulator today and feel that it's complete? Because if you have any doubts, what's going to make it complete 2 years from now when you've forgotten all about it? So record everything as if you're going to rely on it in court if it needed to be, to prove that you actually did this and it made sense. So I mentioned earlier that we worked with the General Dental Council. Some regulators are very specific how they want things to be done. And all of them actually give some sort of templates to sort of say, look, this as a regulator is the specific template that we want you to use or match as much as possible. So we've even had to build our systems to meet that. So many regulators provide templates that are aligned to their audit criteria. So you need to make sure that you know what your regulator wants. So these templates will prompt you to link learning to professional standards. So there are specific code of practices for each one. So you have to link to those particular ones depending on your regulator. You have to be able to explain the impact on your practice, ensure that you include participatory versus self-directed learning where relevant. Because if you don't distinguish that, they may not be able to keep you on the register because you can't prove that you've done the participatory hours. Then use the right template now. It prevents having to reformat it later. So start with a good system, keep up to date with what your regulator wants, and maintain it throughout. Then the journal. I remember when I was a student nurse many years ago, and even medical doctors and other healthcare professionals, allied health workers, they talk about reflection. They talk about the importance of keeping a journal. So reflection is one of the most overlooked but most valuable pieces of CPD tracking, because you ask yourself, basically, it's you. It's almost like if you have to go for a job and they ask you about this particular sort of CPD, you should be able to explain, what did I learn that was new? How will it change the way I work? And what further learning does this open for me? Because you may actually realize you need to learn more. This is just scratching the first surface, so I might need to learn more. So regulators want you to see this applied learning, not passive attendance. A lot of people are actually just passively attending courses to get certificates. And there are many companies also that are facilitating almost industrial production of certificates just to help people revalidate or go through their appraisal. And one thing I want to mention, because obviously we're in a digital era, and you did allude to this as well, we need to take advantage
Yeah.
of digital CPD platforms. So digital systems save time and reduce administrative stress, but it's still up to the individual to think about how they're going to store their certificates when they complete an activity. They also need to think about the date, the topic, the CPD category, make sure that everything is logged properly. They generate regulator-ready reports for instant revalidation or inspection or supervision. Cloud-based platforms are very good, but you have to also think about backing it up. If I keep a digital copy, do I also have a physical copy, or something that I've saved somewhere else? We're all busy, but it's always good to have contingencies as well. So you want to avoid some of the pitfalls. I've seen a lot of people leaving it until the last minute. It leads to a lot of gaps and incomplete evidence. Not necessarily that people haven't done it, but they haven't done their admin properly, right? And sometimes people are only tracking formal learning, and they cannot actually evidence the other types of learning. If I've done this where I sit with nurses, and I'm just helping them through their revalidation, and I said to them, look, what other learning have you done? Because they've got certificates, of course, that they've done online or mandatory training they've done. And they say, hang on, look, you can't tell me that the whole 3 years you've not reflected. You've not done any on the job training. You've not done peer reviews. And they have. But it's easier to just get certificates of formal learning. But to me, it shows that this person is either being very lazy, or actually they don't understand the meaning of CPD and the value of the other types of CPD, not just the courses. So, lastly, I want to mention about, it's not just about logging hours. CPD is not just about tracking and logging hours. It's about capturing what you've learned, how is it relevant, and being able to prove it. Logging those reflections are part of your professional routine. CPD stops it being a chore, and it starts being a powerful tool for career growth, because you need CPD at every stage of your work life, and the whole workforce needs that as well.
Yeah. Yeah, and I think, like you say, it's about getting in the habit of, once you've attended, whatever format of CPD it is, that you do get into that habit of then logging it, evidencing it. So, like I say, CPD in health and social care, which is the majority of our audience. What about the wider workforce support staff, care assistants? It's not just about nurses, doctors, GPs, etc. What about other people within, like you were saying earlier, the wider workforce?
It's very important to think about this, actually, because the vast majority, by far, of the health and social care workers are not registered with professional bodies, like nurses, doctors, dentists, and others, right? They're unregulated roles that make a huge proportion of the workforce. And the quality of their learning also directly impacts safety, compliance, and service user outcomes, because remember, they're also working alongside nurses, doctors, and allied health workers. So, just like with regulated healthcare professions, CPD is vital for unregulated roles because it builds confidence. People can gain knowledge and skills to perform their tasks safely and effectively, and understand the frameworks as well. Boosts their confidence because well-trained staff members, no matter what their role is, even like cleaners, even people working in the kitchen, they're more comfortable making decisions and handling complex situations and dealing with emergencies as well. Overall, it improves service quality, and better skills. It means better outcomes for service users. It reduces the risks, fewer incidents, and even when incidents happen, people know how to deal with them, how to document them, how to manage safeguarding concerns, how to manage compliance breaches or prevent compliance breaches as well. It supports compliance, regulatory compliance, whether it's the regulators in England, in Wales, in Scotland, Northern Ireland. Inspectors expect to see that all staff, regulated or not, are receiving ongoing training that is relevant to their role. So core CPD areas, when you look at health and social care workers, you and I have run a few webinars actually and podcasts where we talked about some of the common pitfalls that we see especially in adult social care in England. Medication awareness, safe handling, and administration of medicine. So you look at Regulation 12, the Care Quality Commission, really crucial for people to know about medicines. Handling medicines, the storage of medicines, administration of medicines, accurate record keeping is really crucial. And that's an area for me that needs a lot of CPD in different formats so that people can really understand what they're supposed to be doing. Dementia is a huge area in adult social care. So again, person-centered approaches to support cognitive decline, which is getting more and more prevalent in society. And safeguarding adults and children, another big area where there are a lot of failings. So recognizing, responding to, and reporting abuse and neglect. Mental capacity, deprivation of liberty, another area where we're seeing a lot of failings. I mean, there are legal frameworks for these things about consent and about decision making. You talked about COVID. But COVID or not, we need to think about infection prevention and control because maintaining hygiene standards, preventing infections, and how to manage them when they do break out is really crucial. The vast number of number of days in sickness in health and social care is related to back injuries, right? More than 50% actually is related to back injuries. So moving and handling is crucial. And there's so many things that I did when I started in the NHS more than 20 years ago that we were using those techniques every day. But those techniques now, if you did those, actually, you could end up in trouble. Apart from potentially injuring yourself, injuring service users and other, it's actually illegal to use some of those techniques. But I still see people using them. I still see people with equipment that is so outdated, even hoists that are not properly inspected. So it's really crucial. Working and handling another huge area where it's mandatory, it's about statutory requirement, it needs to be done. More and more, we're seeing people end of life, so at the end of their life, they need palliative care in the community. So how do we deliver care that is dignified? Making sure that people are comfortable and they have a good death. Their final days. We talk about good death. Actually, we talk about end of life care. Another area where we've seen a lot of issues, nutrition and hydration awareness. So it's not just about eating and drinking. Actually, it's about nutritious meals, ensuring that people have balanced meals. They're drinking enough. Like right now, this summer has been very hot in England. Those days, actually, you see quite a lot of issues related to heat fatigue and people dehydrated, and then they end up in hospitals. They end up with multiple infections. Record keeping and confidentiality, really crucial to be able to do that. With GDPR, with the Data Protection Act, and other standards that we need to follow. So, when it comes to adult social care workers, particularly, the onus is really on employers to ensure that they educate people properly. When you hire people, some of them are completely new to health and social care. What sort of induction are they going to get? What about statutory and mandatory training? What sort of supervision? What sort of refresher training do they need to do? Because you have to tell them from day one that it's all about lifelong learning. Once you do this course today, things don't stay the same. So CPD has to be embedded in the culture, in the non-regulated services, and employers have a duty to offer accessible and relevant training. So mixing face-to-face training, e-learning, on-the-job training, and some people are doing night shifts, so they're doing weekend shifts only to make sure that they're not left out because quite a lot of emergencies happen out of hours or over weekends. The outcomes are very poor from the research that we've been looking at. You want to always link training to outcomes. Show unregulated staff, your social care workers, your care assistants, how learning improves the lives of service users, how it improves the outcomes. It should be relevant in that sense. Another key area is making sure that they have protected time for learning. Quite often, care workers are doing long shifts and they're expected to complete training in their own time. It's impossible to do that. And it's unfair as well to ask people to go and do training in their own time after 12-hour shifts. So, some employers that we have worked with have started recognizing and rewarding people that complete their training, rewarding people that complete their reflections and can link this to their work as well. And just like what we do with nurses and doctors, how do you ensure that there are systems to evidence training for everyone? All the members of staff, actually, including the unregulated members of staff, and teaching people as well that they have their responsibility to ensure that they track their CPD, but providing them with systems to be able to do that. And what I've seen as well, whenever I talk to directors and people that are running social care services, I say to them, okay, what tools are you giving your managers, your registered managers, and other people, team leaders, to be able to think about CPD all the time? And quite often they've not even thought about it. Because unlike nurses and doctors who have gone to university and they are told from day one that it's about lifelong learning, but also there's a culture there already for people having to do learning to improve their practice. For care workers, it's not always so obvious. So prompts for leaders and managers to say, can you evidence every member of staff actually to say, regulated or not, its current training record that is up to date? Also, do your training plans link directly to service user needs? And also the CPC questions and quality statements. It's a whole separate area that we can talk about. But also, is CPD treated as part of the job or as an optional extra that is squeezed between shifts? And I'm afraid to say the latter. CPD is not it's not treated as part of the job. Quite often, CPD is a chore that people need to do. They hate doing it in most cases. So we have to make training interesting. We have to make training accessible as well and rewarding as well. So everyone in the organization, not just people with professional registration, needs to have CPD. If you raise the standards for all the roles, you raise the standard for the whole service. And also, that's how you build a culture of safety, whether it's service user safety, patient safety, quality as well, and continuous improvement. You have to put the onus back to the people, and you also have to address those challenges and implement best practices.
Excellent. Yeah. So I think, like you say, it's not just about it being a professional requirement. It's also trying to build in that culture of improvement, which will then lead to better outcomes. Those better outcomes improve the service overall, and like you say, improves patient sort of satisfaction as well. So you touched there on challenges, common challenges and sort of best practice. I just think it'd be interesting to sort of close this segment by touching on some of those things. Obviously, you've lived this experience, as you've rightly said, and you've worked with a lot of nurses even now, trying to support them in putting CPD together, advising them, even helping them with their submissions. So, yeah, what are some of the common CPD pitfalls or challenges you've seen in your time in the sector?
So sadly, there are a lot of consistent barriers across the sector. Whether you're talking of healthcare, NHS and independent providers, we're talking about other social care, social services, they've been amplified mostly by the pace of change in health and social care. If you think about it, NHS England was abolished. There's so many changes to how systems are supposed to be working. There are a lot of workforce pressures as well, shortages of staff, and all that. So common challenges, the main one is time pressure. Say there are heavy caseloads, there are heavy shifts, staff shortages, and it means that CPD gets pushed down further and further. I remember last time I worked in A&E was 2017, early 2017, and every time I came in for handover in the morning, one of the managers comes in to say, if you get time, please, can you go and do that course online? And I'm sort of thinking, I barely have time to go and have a proper break. Sometimes I forget to drink water. How am I going to make time to go and do CPD on a busy shift when there are patients in the corridors, there are ambulances waiting outside? It's impossible. So you're asking people to do the impossible, but you also know that as an organization, there's nothing that we are doing to support them, right? So sometimes I think we need to be open and honest to say, as much as we want to push the responsibility to staff, organizations have a
Yeah.
duty as well. It's reciprocal in that sense. And also we're working together. But when push comes to shove, sometimes I've seen nurses and doctors and other healthcare professionals being left to their own devices actually when they get in trouble. So, oh, why didn't you do this? Because you think, hang on, time pressures, right? So in many services, staff are expected to do CPD in their own time. Which reduces engagement. People hate to do that. Well, you're encroaching on their time where they're supposed to be resting and recuperating from long shifts, then uncertainty as well and lack of clarity. So sometimes people are not sure what qualifies as valid CPD, which is why many people end up just doing courses. They don't do the other types of CPD because they want to, if they're doing it in their own time, I want to make sure that they're not going to ask me to do it again. So people end up doing the easier type of CPD, which necessarily does not always translate to better outcomes in that sense. And managers may not link CPD to regulatory frameworks and specific improvement needs as well. And sometimes the CPD is too heavily leaning towards statutory and mandatory training. CPD needs to be broader than things that we have to do. Of course, things that we have to do them. They count as CPD still. But what other things could we do that will actually give you an outstanding uh, CPC rating rather than just the bare minimum, right? So that's a big issue there. We talked about last minute rushes where people are desperately scrambling before supervision or inspection or revalidation to try to gather evidence. And reactive approach leads to incomplete and low quality documentation. And it's an issue of quantity versus quality, right? So there's over reliance on quick wins. So low value CPD courses that tick boxes but don't improve practice. We all know what we're talking about here. It's well known in the sector. There are so many companies out there that if any employer gets their certificate, they know that this is poor quality training, but it ticks a box. But guess what? They'll still accept it. Right? And you and I have had to deal with organizations where they've got everything documented, but they fail dismally. And then we go then start afresh and rescue that organization. It's not good for anyone. Another issue is workforce turnover and continuity or discontinuity in this case, where training records, they're fragmented, they're all over the place. I know Skills for Health have tried to sort things out in a way where there's a national registry almost, where if you get a certificate from an organization that is recognized and accredited and aligns with the framework, then you don't have to repeat the CPD. Um, then new staff may join with gaps in their knowledge, including even statutory mastery training, so requiring quick catch up. And what often happens is when they do the quick catch up, they realize that the box is ticked. Then there's no incentive even for the organization to do anything further because once I tick a box, I may want the best training ever, but once I tick a box, what incentive is there for me to do anything further than that? So another area is sector changes and compliance demands where there are constant updates. Like now we've had a new government, or we can't call it new, they've been in now for over a year. They've made so many changes and so many things, people are uncertain as to how things are going to go. It creates an environment where people, CPD gets pushed out further and further. It doesn't become a priority for anyone at all because it's all about survival now. So I want to give a few best tips as well. If I go back to your question, so look, how do we maintain effective CPD? Schedule it almost like your doctor's appointment or your dental appointment. You know, non-negotiable, protected time in the rota for staff, right? Use a tracker consistently. So activity logs throughout the year, as and when it happens, not just to meet deadlines. Then you also need to reflect and log immediately. And managers as well and supervisors, when you do your supervision meetings, make it a habit to get people to reflect. That's why CPC are pushing for the we statements and the I statements. I think it's a really good way to get people to align the activities that they're doing with the outcomes of the people that they're serving. So we also want to seek high quality, relevant opportunities, learning opportunities, whereby we are thinking about the role and scope of practice. We're thinking about the current service priorities and risks within those services as well, because not all CPD meets requirements of all services. It's not a one size fits all. You have to think about customizing it for your organization. Then you need to think about the latest evidence-based guidelines as an organization, but also as individuals. So link CPD to outcomes. That's non-negotiable. And you want to blend learning formats as well. You don't just want to pick one and stick with it. Keep evidence inspection ready, whether you're an organization, you're an individual, is it ready to be submitted? Otherwise, if it's not ready, fix it then and then as you go. And again, if I go back to prompts for health and social care professionals and managers, again, ask yourself, can you provide your regulator or CPC inspector with a complete, well evidenced CPD record today for all your staff? If you're an individual, can you submit your professional body today? If you can't, then you really need to go and do it straight away. Does your CPD plan prepare for upcoming regulatory changes in the sector, right? Because quite often we've seen even with us as always an organization to maintain courses and other CPD activities, it's a challenge, right? So we need to make sure that when we update things, everything is aligning with the latest frameworks as well. So staff as well, if you're an organization, are your staff empowered and supported to learn? And when you think about it, CPD is treated as a burden. We need to change that and make it part of the job actually. So look, like one of the organizations we recently worked with in the Southwest, where they were saying we've added it to the contract to actually say you can only get a bonus if you do your CPD and check your CPD. And then all of a sudden, everybody wants that bonus, the quarterly bonus or the annual bonus. Then they do it because there's a monetary value now placed. So organizations are finding inventive ways to try to get people to do what they're supposed to do anyway. And lastly, how often is learning reviewed for impact on practice and on service quality, service user outcomes? Quite often it's non-existent. Whenever I ask business owners or managers to say, look, how do you review the effectiveness of training? You're spending 50, 60,000 pounds annually on training and development. How do you review that to see whether it's effective or not? Quite often they don't. I don't know your experience. So say, I know you have dealt with organizations. So what's your experience in that area? Do people realize actually that they need to review for impact? Even for us as an organization to say, look, are we delivering training that has an impact on the service?
Yeah, I think it's an interesting point. I think a lot of people put a lot of effort into getting it set up and pushing people to do it. But the reflective side, and then looking at actually have things improved? Is this training actually making an impact? Are people actually learning? Do they actually know the new laws that have come in or regulation? I'd say that area is pretty poor. You're talking gold standard organizations, and even some of those fall quite short of that mark. So I definitely think there's a case to be made in organizations at all levels in healthcare and adult social care where that a bit of time is needed to look at that reflective side to sort of say what is the impact of this, whether it's a training, whether it's a new initiative in the business, whatever it is, but particularly with training and development and CPD, it's very rare you see that, if I'm being honest, with the organizations we work with.
Definitely, and it's a challenge because we've had recent examples, for example, where you think, wow, this organization is going for the gold standard, as you mentioned. You do the planning, you invest a lot in getting the needs analysis done, the matrix done, you go and deliver the training, and they don't want to know after that. Nobody answers the phone, nobody answers the emails because they just think, hang on, they want to take more money from us. So again, funding is another thing that I should have mentioned when it comes to the barriers. So say, look, you have to actually allocate quite a substantial chunk of your budget to training and development in CPD as well. But it's got to be done properly. It's got to be structured. It's got to be relevant. It's got to be properly evidenced, and we have to be able to prove that it's changing outcomes. So we link it to our outcomes as a business, and even as an organization. What are we doing to ensure that it's tracked properly? What are we doing to ensure that, how many organizations have come to us wanting training this Saturday or this Sunday and think, why do they want to do training on a Saturday or Sunday? Right, to start with, it's very costly. It's going to be very difficult to get people in the room. There's always a problem. It's because they've not been tracking it all along. They've missed the ball at some point, and now they know that they're in trouble. They need to plug that gap. And you can tell from a mile that those sort of organizations, or even people that come looking for sort of last minute fixes.
Mm. Yeah, so just to sort of wrap up, I think we've talked about, like you say, the people working, the individual professional, but also actually touched on employers and what they can do. And I think that's a really interesting angle, um, regarding continuing professional development, the employer's duty, or what the employer can do to make the life easier for some of their staff. So I think that's a good point. And like we say, we know there's a lot of blockers to some of these things, particularly from a funding perspective, but also a time perspective. I think that you've homed in on that, whether that be decision makers or employers, or whether that obviously be the individual themselves. We know that a lot of the shift patterns now, they're very demanding shifts. Any downtime you get, you don't really want to be spending sitting on a computer or attending an event or listening to a podcast, even maybe. So, yeah, I think they're all some really good points. And they lead us on nicely, I think, to the last segment of today's episode, where we're going to actually touch on an initiative we've launched and will be launching next week for all our current users on our ComplyPlus system. And that is the ComplyPlus CPD Tracker. It's been something in the pipeline with our product development team for the last 6 months. It's finally coming to fruition, and we are launching it for free for all existing users on the Comply Plus portal next week. So there will be some notification around that. But Richard, from your side, what's your overview? You're obviously a big backer of this initiative when it first come to the table earlier in the year. So if you could give the listeners a bit of an overview, um, yeah, please go ahead.
Yeah, it comes from experience as well. So say, look, I have to maintain my CPD as well, like many healthcare professionals out there. But many people that I talk to, even very senior people, they get stressed and overwhelmed actually by the admin related to CPD. Unless you have a really good system already, it can be quite a challenge. So, and there are a lot of missed opportunities for learning because tracking systems are clunky, inconsistent, and non-existent, and I'm yet to see a good enough system. So what we sought to do was to build a system that helps people to evidence. It's an organization that evidence staff development and make sure that they're inspection ready, or they're bidding for work, or they're reviewing their contracts with if commissioners are reviewing contracts, you can show evidence. So what the tracker does is automatic logging. So if you do training with us, it does log your CPD automatically. But you can also, we've enabled it to be able to upload. People can upload certificates that they gain from somewhere else, and they log the things that are crucial, so date, expiry date, the type of CPD, so that you have a nice dashboard which tells you exactly where you are, how many participatory hours do you need to do, how many self-directed hours have you already done, so vital for meeting your requirements. So storage, because you're storing everything in one place, which is secure, you keep all your evidence in one place, you can search, you can update, and if you're missing hours, you can book some online courses or webinar to attend. We also give you a lot of tips on how to accumulate good CPD hours. So for organizations and even staff, is regulator ready reports. So if you're submitting to NMC or HCPC or CPC visits or whatever the case, it's ready there for you to use. It's accessible from anywhere because it's cloud based. So yeah, you can update on the phone, on the tablet, on the computer, right? So at any time, and you'll be able to download, you'll be able to see what you need to do. It matters in health and social care because it reduces stress of doing last minute CPD admin, so try to meet deadlines as well. It improves compliance confidence as well. So if all the people know where they are, regardless of what role they have in the organization, the managers know as well. The managers have a good dashboard that shows them where everything is. It's efficient and it saves a lot of time. It supports team-wide development as well because you can group your teams into groups and then manage their CPD in that perspective. So it's free, like you say, for everyone because we didn't see the point of charging people for this. It's a service that costs us money as a business, but we did it because we are seeing a lot of problems in the sector that are easily solvable with basic tech, right? It's easy to use. We've designed the front end so that it's really easy out. We're thinking, like you say, I came in from a user perspective and even LC as well, and other healthcare professionals that they helped us to build this by telling us their own experiences. So it's designed for any role, not just regulated professionals, even care assistants, support workers, managers. It's really important. So again, I say the same prompt again. So if your regulator or your professional body walked in tomorrow, could you hand them a complete, well-evidenced CPD record without spending hours searching through emails, filing cabinets, multiple systems? ComplyPlus Tracker does that. It gives you everything all in one place. So for me, it's not about selling software. Sometimes it's actually about providing simple solutions that are easy to use, that help people get organized, that have high impact actually on the service delivery and outcomes as well. So removing all the admin headaches, free for people who matter the most, people that are delivering care. We want that care to be safe, we want it to be high quality, and they are continuously improving their practice and tracking and being able to evidence that as well.
Excellent. So, like I say, you will hear from us very soon on this next week. If you do have any questions, please do reach out to our team regarding CPD. Any questions from today's podcast, love to hear them. We'll make sure we make time to answer them. And like I say, keep an eye out next week for the ComplyPlus CPD Tracker announcement, and make sure you log into your account to give it a go, whoever you are. So, like I say, thank you very much for listening. Richard, thanks a lot for joining me again today, and I look forward to doing this all again next week.
Thanks, Luis. Thank you to all our listeners and viewers. See you soon.